So let's move on to the clinical features. By now everyone will be knowing the clinical features of anemia, but what is the most common presentation? It is going to be asymptomatic. Yes, if a child comes to you routinely at the OPD, it is going to be pallor which is diagnosed by the doctor, then we go for blood investigation, isn't it? So asymptomatic presentation is the most common one. Next is going to be pallor. But when does one start to look pale? When the hemoglobin actually falls to less than 8 gram, at least 7 to 8 gram per deciliter of hemoglobin is necessary to demonstrate pallor in the child. What are the sites to look for pallor? I am going to show you all the pictures in the next slide. So we will go on to the other clinical features which are not very common but will clinch the diagnosis of anemia. Cold intolerance. Many times we think of cold intolerance and we associate with hypothyroidism, but no, even anemic patients also complain of cold intolerance. Fatigue in children, very common. Mothers complaining of weakness in child. My child doesn't play, doctor. Whenever my child plays, there is a breathlessness or there is a dyspneic episode, exercise-induced dyspnea. And decreased concentrating ability. Small kids, preschoolers, especially, they don't concentrate. Even in school going children, adolescents, they are not able to concentrate in studies. Their memory power decreases because iron plays a major role in neurocognition. Very small kids, 9 months, 12 months babies, they present to us with irritability. Baby crying non-stop, the child doesn't stop crying, doctor, we have tried everything. So irritability is a very common symptom for iron deficiency anemia in very small kids, especially in infants. Followed by anorexia, and if the anemia is very severe, it results in congestive cardiac failure, so we can know a flow murmur on auscultation. So I was talking about neurocognitive defects. When severe anemia, even seizures can be a presentation. Stroke, arterial ischemic stroke can happen when there is severe iron deficiency anemia. Breath holding spells, they don't have a direct cause-effect relationship, but many a times we see babies with iron deficiency anemia presenting to us with breath holding spells, and the management of a breath holding spell definitely needs correction of iron deficiency. Pica, ingestion of non-edible substances is pica. Pagophagy is ingestion of ice. So all these are very subtle features which are noticed by the parents, but unless and until probed by the doctor, parents don't come up. So these are the clinical features of anemia, a very important slide, not only for the examination but for an everyday practice. Yes, so this is a slide which shows where to look for pallor. So multiple sites we can look for pallor. So number 1 is in the conjunctiva, palpebral conjunctiva. Look for the anterior and look for the posterior rim. So first the pallor appears in the rim and then the conjunctiva becomes washed out. Next, look for the nail beds. Always compare the examiner's or the doctor's nail beds with the patient's nail beds. So nail beds can appear pale. Look for the tongue. So 3 different categories. No pallor, pale looking tongue, a severe pale looking tongue. And the last site, palmar creases. Again, compare your palm with the baby's or the patient's palm. So look at the creases, well formed, well appearing creases. Here the creases are appearing little dull. Compare with the examiner. This is a severe palmar pallor. Maybe the hemoglobin is around 3 to 4 grams, where you can hardly see any palmar creases.